Hello, peeps. Welcome. Our guest for this episode is, I think she should introduce herself to you.
Hello, I'm Dr. Ushma Patel, a veterinary surgeon with a specialization in avian medicine and surgery. But have you thought of what all work goes behind becoming a wildlife veterinarian? Let me tell you, I have had an opportunity to treat all creatures big and small, right from the snakes, birds to jackals and tigers. With the growing civilization, so many animals are a victim of man animal conflict. Due to lack of awareness, the wild animals are the ones which are usually killed or rehabilitated to a different location completely, as if the reset button has been pressed for the life of that animal. So I try to educate the young minds who are the future of our planet that is not the only solution. Coexisting is. Another heart-wrenching image is of thousands of birds dying during Makar Sankranti festival in the states of Gujarat and Rajasthan predominantly. I have been performing avian surgeries and now even teaching them to budding veterinarians, as it takes an army of people to make a bird fly again. We have managed to release back birds that are injured, like vultures, pelicans, eagle owls, painted storks, and even sparrows. For my work on avian surgeries and prosthetics, I have received 2 national golds and a silver from the Scientific Committee of Veterinary Surgeons in our country. Also, I'm the first veterinarian in the country to have made a scientifically customized prosthetic leg for a black kite in 2014. After these years of operating more than 2,000 birds and many other wildlife and pet animals, I can definitely say that the career of a veterinarian is a rewarding career, because one has the opportunity to care for beings who can't care for themselves. It is a sensational and a phenomenal feeling. I thank Punarva's Youth Foundation for deeming me worthy of their recognition amongst other brilliant young professionals. I hope I can inspire and motivate more students to take up this amazing field of work. A quote from F. Scott Fitzgerald, the great Gatsby, once said, I was within and without, simultaneously enchanted and repelled by the inexhaustible variety of life. That is what it is to be a veterinary surgeon.
Welcome, Ushma. It's indeed a pleasure to have you. Okay, very curious. From a state chess champion with a FIDE ranking of 1753, you choose to become a veterinary surgeon.
Basically, it runs in the blood of the family. My parents, when we were very young in Bombay, my sister and I, for us, they were the inspiration and role model to start with. And what they did was they used to, of course, rescue animals and things like that. But when we were in Mumbai, we had luckily some extra space around our house. So instead of getting into things like gardening and other making it a lawn and a fancy place, they decided to put up a few cages outside. And what they did is they tied up with a local NGO who was treating stray animals for free of cost. And the only trouble which they were having is when the animal or bird, especially birds, would require long-term treatment, and you cannot leave them back on the road if they had no place to go. So they decided that we will give them this place free of cost, let them come, keep the animals and birds over there, and the vet would come twice a day, medicate them, and once they were completely fine, they would be released back from the place they were rescued. So this is what they started doing as an initiative, and we were those young little excited helpers of when the van would come to treat the animals. I would rush out to make sure that I was the one who was assisting the vet and not the vet assistant who was supposed to do it. And they were more than happy to let me handle the birds while they did the dressing and treatment. I couldn't understand a thing, of course, at that time, but definitely that played a major impact in rescuing of birds and animals at a very young age. Apart from that, just a little bit about my family is my sister and I both are professional snake rescuers. Apart from that, my mom, she is actually a Guinness Book of World Record holder for cycling.
Okay.
Basically, my dad and mom both were adventure cyclists. So my mom is the first woman in the world to bicycle to Khadungla top, that is 18,380 feet above sea level, when she
Wow.
was only 26 years old.
So basically,
And
sports and passion for animals runs in the family
yes,
simultaneously, which
it just runs in the family. And my father and mom, both of them have cycled from Bombay to Kanyakumari, Bombay to Nepal, Bombay to Delhi. So
wow.
this is all when they were maybe 26 to 28 years old. So once they got married, they toured around the European countries, 8 European countries for 3 months only on bicycles, just the two of them. So that is their idea of adventure. Apart from that, my father was a gold medalist bodybuilder at that time, and he was a university chess champion.
Okay. Can you give me the
So
names of your parents?
my mom, who was at that time, she was Leena Mehta.
Okay.
When she got her Guinness Book of Record, now she goes with the name Leena Patel, and my father is Deepak Patel.
Okay.
We had the sports part in our family. My sister also did the same thing when she was 16 years old. She bicycled to Khadungla top, and she was featured in the Limca Book of Records for being the youngest girl to bicycle to that place. But of course, then there was a younger girl who did the feat, so then it was replaced. But yes, she did the same thing. And I, instead of going for adventure sports, I took after my dad and started playing chess professionally from a very young age. He was my first coach.
Okay. So
So
intellectual, you used to choose intellectual sport, right? A little
yes,
more brainy.
yes, the more brainy, the more indoor kinds sport. And I went on. I mean, I pursued it seriously, and I went on to become the state champion in 2007. Eventually, I got the national bronze, and I have also played the Asian juniors representing our country
Mhm.
in Singapore. So that's how I really would have loved to pursue chess. Had it not been my dream since I was probably in my fifth standard or something to become an animal doctor. So then I went on to pursue my long standing dream of becoming a veterinary doctor. So that's how the shift happened. And I don't know whether I like animals because there were chess pieces are also animals to an extent, or
Yeah.
I like chess because I used to anyway like animals. So
Okay. So that is not sorted. That you're not. Okay.
yes.
So that's how like the switch happened from I mean basically both sports and passion for fun. So your parents, they do have that shelter still, like where they like, you know, the animals and the birds can be like they're
So that was in Ghatkopar in Mumbai, and that was many years ago. Eventually, we shifted to a place in Powai.
okay.
Now, the place where we stayed in Powai, we stay in a high rise. So that is not possible to have such a wonderful setup which we had in Ghatkopar earlier. But now I have one place which I'll show you eventually in Nagpur where I am.
Okay.
So on the footsteps of my parents, I've built a similar place in Nagpur, in the place where I'm working right now.
Why did you choose why did you choose to specialize in avian surgery? Like any specific reason?
Clarification while you introduced me, I'm a PhD scholar. I will still be finishing my PhD in veterinary surgery and radiology. That's one
Okay.
thing. Um, Apart from that, in my master's, when I was specializing in surgery, I worked on avian orthopaedics, that is on fracture management of wild birds, basically.
Uh-huh.
And this thing, basically, I think it is because in my childhood, I did see a lot of birds. Very little being done for birds, honestly.
Uh-huh.
Pet practice has boomed. Nowadays, exotic animal and bird practice has boomed because people are keeping exotic animals and birds. And there is an awareness how to keep them and various other things. So
Hmm.
people do come forward and get their animals checked. They even pay for it, whatever the cost for the treatment. But honestly, for wild birds, I mean, I have hardly seen people pay attention to the birds or the surrounding area. Even if you're sitting and if you look out of the window, you will at least see 3 to 5 different species of birds in a span of 10 to 15 minutes. But people miss this, and I have seen so many birds that have come in with fractures or other conditions. And most of the time, while I was doing while I was studying, and before that also, I've just seen people, oh yeah, it probably won't survive, it's a delicate thing anyway, we can't do anything about it, just let it be and feed it till it survives. So, or they're in permanent captivity, or the wing is amputated, or something like that. And there was no proper guidance to how birds are to be handled, and especially when it comes to wild birds. So there are a very few handful vets in our country who have done tremendous work in avian practice and exotic practice. Most of them are in Bombay, and they're doing brilliantly. We have a lot to learn, and they are constantly evolving. So, and I am myself trying to evolve in whatever ways and opportunities that I can, and especially also about bringing in awareness that injured birds may not necessarily die. It will have a chance to survive only if you make sure that the correct first aid and ethical rescue practices are followed. And if you come to the veterinarian or the rescue centers in time, the birds do have a second chance to life. In
Like
fact, while I
anybody
was
else.
so basically, I operated more than 70 birds, and these birds they managed to survive, and so many of them I was able to release them back in the wild again. So they're not as delicate as we think. They just require the right amount of push, the right amount of medicine and help, and that will really help us bounce them back into the wild. So efforts should be taken basically, and awareness should be made that avian practice is something which really requires a specialization. It requires an amount of studies that have to be put in, and we probably know about 1 to 2% of the entire avian biology, medicine, and surgery part. But everybody is trying to just evolve and help them in the best possible ways.
Okay. You also created a prosthetic leg for a bird, right? That was it was the first of its kind surgery in India, if I'm not wrong. And can you tell us something?
Yeah, so that was in 2014. A colleague of mine and I, we had been to Bangalore to intern at a wildlife rescue center. And the vet over there, she amazing wildlife vet, I must say, and Dr. Satish. So she was the one who showed us this black kite who had already an amputated leg, one single leg because of kite string, and because there was only bearing in one of the legs, the only other leg, it had all injuries and a condition called as bumblefoot, that is ulcerative pododermatitis in technical words. And it will not heal unless and until the weight is shifted to the other leg, which was not there. So it was in quite a lot of pain, and probably the most humane thing at that point would have been to euthanize the bird. But Dr. Rupa, as well as us, were not in the that was not our option that we wanted to go with choice. And then eventually we asked for a week. We came back to Nagpur and we spoke to a human prosthetic surgeon, and then we tried to devise something from the material which is used for human prosthetic legs. And we came up with this prosthetic leg, which we then sent it across to Bangalore. There was some minor adjustment that had to be done, so it was sent back to us, and then we sent it again. And the bird was of course in permanent captivity, but able to use the leg eventually. So the other leg could heal. So that was the start of prosthesis in birds in India. There have been multiple cases that have been tried and tested by other vets as well. And there have been prosthetic beaks that have been developed. There have been more legs that have been made by other vets. So now there is a push that we can still do. 3D printing is a new technology that we are harnessing now for these prosthetic beak and legs. And apart from that, we are, what do you say, trying to tie up with IIT people and get them also help us with their technology and our what do you say, challenges of getting such tiny legs and customized legs for that matter.
Okay. Okay. You also work with wildlife, isn't it? Like, and so what is the kind of experience you have examining wild animals to detect, determine, and the nature of disease or injuries, because they are not easy to handle?
I think every veterinarian who is practicing at some point has handled wildlife, to be honest. But my passion was always and still is that I work with wildlife for more time of my life, because that is one sector which requires dedicated vets. Now, what has happened is I'm still a part of the academic system, so I get a lot of opportunities to work with wildlife through the college, through the university. And Nagpur basically is the central India is also called as Wagpur, because there are so many tigers around, there are so many carnivores and herbivores around. So we do get a lot of conflict cases as well. Tigers killing people, and poachers putting up snares, and then they're getting caught in the poacher snares. So all these things we do get an opportunity to work with. Now handling them, we cannot handle them the way we do domestic animals, obviously, but we use chemical immobilization wherever possible and wherever the animal looks fit for sedation. So we dart the animal and we sedate the animal quickly. We don't have too much time. Time is of value at that point, and we have to be very quick. There's a lot of presence of mind required. There can be a lot of things that can go wrong in the field, and field conditions are nowhere close to where a proper clinic or a hospital condition would be. We probably would have very limited drugs with us and very limited what do you say, dressing and surgery tools with us. So major surgeries are mostly not done in the field, but at least they are dressed, they are given the support that they require, and wherever possible they are released back immediately in the wild. And wherever possible, we think that it will require some days of treatment, they are put in a trap cage or a squeeze cage, where the cage is, one part of the cage is squeezed, so the animal cannot move too much. The treatment is done on a daily basis, and then they are released back. And the appetite, consumption of their food, and everything is taken a note. I mean, everything is noted. Because the appetite is one of the major factors on which we determine whether the animal is healthy or is it improving or not. If the animal is feeling hungry, it will eat. There is no way it will not eat. So if it will eat food, or how much it is eating, what is the usual diet of that size of an animal, that is all recorded. And then we on judging the behavior, because we definitely cannot talk to them, we have to understand their body language. So judging by the body language, we determine whether the medicines are working, or we need to change, or we need to do some intensive therapy. So these are specifically, especially to leopards and tigers that are being treated. So it's very difficult, of course, but challenging, yet very exciting. And the best is when they are released back in the wild. That is the best way to.
And that's a way that you must be getting a kick also, like, and a satisfaction. Yes.
Definitely. That is the only day we can actually have a good night's sleep. That is our reward. That's it. That they are back into the wild. And apart from that, like you asked me, my work on wild avians. So since 2015, I have been associated with NGOs, various NGOs that work on birds, especially during the Sankranti season. So that is the time when there are thousands and thousands of birds that die because of the kite string, and it is a massacre. It is, if you see, it will bring tears to your eyes. Every single day there are more than 800 to 1000 birds that are brought in by rescuers. So these are only the ones that are informed by people or brought in by rescuers. Other birds are still so many of them who don't get the help, or they die before getting the help. From these 1800 to 1000 birds in those that 1 week of summer actually come to the rescue center, out of that 20% are already dead. The rest 80% have a bleak chance of survival. Some have their throats slashed, some have wings cut. We have had birds that have come in one basket and a broken wing in the another basket. So it is absolutely sorry state of affair. And these birds are not just pigeons, crows, or black kites. These birds range from small sparrows to vultures and flamingos and cranes and whatnot, because that is also the peak migratory season for birds to travel from abroad to India. And since I worked in Ahmedabad, I've worked in Jaipur, of course in Nagpur and Bombay during this Sankranti season, and we've operated on pelicans and lapwings and eagle owls, barn owls. My God, the list is numerous. We actually 1 year we found out we got a record number of 173 different species of birds during 20 days from 1st of January till 20th of January. So it's very heartbreaking. Plus, it's not just operating them, it's operating them, getting them out of that shock, making sure they get the correct diet, the dressing is changed, then they get the physiotherapy so that the wing which is, or the leg that is bandaged, is not getting atrophied because there is lack of exercise. So we have to open the wing, slowly give them physiotherapy, and then shut it back with a bandage till we find it is fit enough to be left open. Again, there are so many challenges because these are wild birds and they don't like anything which is put on them. So they will pick on the bandage, they'll try to damage the surgical side because they just want to pick on whatever foreign object, or if there is some pain over there, they will try and remove it or peck it with their beak, and that may cause further complications. So there are so many things that go in, and it takes an army of people to rescue so many birds. Usually the number ranges from 2,500 to 3,500 birds each season in bigger cities like Ahmedabad, in Jaipur, in Rajkot. All these cities in India, they have that many number of cases reported to a single major NGO. So I mean, if we accumulated, the number would, I think, easily go about 10,000 injured birds. So it's very.
I have rescued
I
so
mean,
many birds,
yeah,
hanging from
Gujaratis.
this thing.
I mean, it is a festival which is celebrated by my community of people, and I have had such a tough time explaining it to them that see the other side.
I know.
It is all fun and games for us, but it is really.
It's not fun and
I
games
left
for the people.
the Hindu festival, and we cannot definitely we cannot stop festivities completely. That is not possible. We know that. There's no point in talking about
I
it. But
know.
what we can do is we can make people aware that in the morning 5 to 7 a.m. and evening 6 to 8 p.m. are the two times when birds fly out of the nest and come back to the nest.
Yeah,
So this
maybe
is
that
the
is the
time
time
where
they
we
can avoid.
yes, avoid kite flying, and if possible, during the other times of the day, try and fly it in open grounds instead of different terraces. You know, one single place, open ground, so the damage is at least controlled to one area rather
Yeah.
than the entire city. So
True.
at least we definitely push a lot on flying kites between 5 to 7 in the morning and 6 to 8 in the evening. So that is something that may probably help us in future.
Yeah, it's just the part thing that more awareness has to be created to let people know ki like, okay, there's fun part to also to it, and then there's a tragic part also to it. So we need to take consider both the sides and then come out with a way, so that you also have your fun and others also don't suffer. So what is most
Correct.
challenging for the Bible? Coming back to wildlife, what is most challenging? Like giving them, like, once you like, how do you give them medicines? Like, as you must can't pop in pills in. So it's always through what injections. So how do you do that? It's really difficult, right?
Correct. So, when it comes to wildlife practice, basically we have to understand that we are probably going to get just one chance to collect the samples that are of diagnostic value. Probably one chance is the animal is going to give us. So when we dart the animal, the wild animal, for the first time, we try and collect as many blood or urine or fecal sample as possible and try and get all the diagnostic values that we can, correlating it with the clinical signs. Apart from it, dressing of the wound, of course, it cannot be done in as wonderful way as we do it for pet animals. We cannot bandage them. They will definitely rip it off in a
You
minute.
can't also,
We
you can't do that.
we can't make them wear a cone of shame as well.
I know.
So, we can't stop them from licking the wounds. All we can do is make sure that there is no maggot infestation on it, or there are no extra secondary infection that is happening. Talking about giving them medication, most of the times, if they are carnivores, we can give them medication through meat or beef or chicken pieces, and we give them little part first when they are very hungry, so they'll eat it without trying to remove the medication out of it. They will just take it in, and then we give the other rest of the complete diet. Same with herbivores, we try and hide it in the things that they like, maybe jaggery or something which they will definitely eat it for sure, and that's how we can give oral medication. But certain times, injectable medicine we know will go 100% and is required for sure. Some oral alternatives are not available. So during those times, we either dart or we have something called as a jab stick. So that is used from a distance to jab the injection if it is in a cage, or if it is in a little a bigger space, then we use a small dart gun which is used to inject via dart, and then the dart falls off. So that is collected later on.
So once they are released, you release them. Once they're 100%, you're sure ki like they are fine, or giving like in the field when you give some treatment and you feel okay, now we can release it. So how do you keep an eye on them? Like, you have to observe them ki like whether they are like, it's not a relapse of whatever, and like they're fine.
So I'll
They're
give
doing
you
well.
an example of a tiger, a male tiger, which was in Tipeshwar Wildlife Sanctuary. Now, my husband is also a wildlife veterinarian, and he works with tigers exclusively. And he had this case where the male, his leg was entrapped in a poacher's snare. So what they did was, for a couple of days, they did track it and found out where, at what time usually they see the tiger. And this is completely wild. They're not used to humans. They are not used to getting food. They hunt on their own. This is completely raw wildlife. And what they did was, they did put in a few baits, but the tiger was very smart. He did not fall for the baits that were tied for him. And eventually they found out through camera traps where the tiger would actually be at what time of the day. And with that probability, they sat on machans for days and nights, and finally found the tiger and darted with a tranquilizing gun. And they sedated the tiger, immediately removed it was a nylon snare, and you could actually see it cut through the muscles almost, because the more it's like a noose, and the more it stretches it, the more it tries to yank it, the tighter it keeps getting. So they removed it, immediately dressed it, and they saw that there were reflexes present. So it was able to walk, and the nerve damage was not present, thankfully. So they immediately radio collared it for that time. And then with the GPS location, they tracked it for over a week's period. And within on the second day itself, they saw that it hunted a wild boar.
Okay.
So they knew that the animal was going to be fine, and they don't need to keep it in captivity or anything. So that's how the monitoring happens. It's a huge thing. I will share a few photos of his
Yes,
work.
yes.
He has brilliant and exciting work that he does. I'll definitely
I would like to interview him also. You really need to be very patient when you are dealing with the animals. So how do you keep your emotions checked when, like, has it ever happened that you've really, like, anytime when your patient was tested and you had to control your emotions?
That is a very, very good question, because most of the time vets are deemed as heartless. I'm telling you, I have heard this a lot of times, but it is almost on a daily basis that we have to keep our emotions in check. We see people abandoning dogs and cats. We see animals that are euthanized. I mean, we have to euthanize them, and there's nothing that can be done which has an end stage kidney failure or other malignancies. So at these specific times, it is very difficult for us as well. I mean, even though the owner thinks that we see this every day in, day out, it is definitely not easy for any of the vets out there. We cannot not take our work home. Every vet out there is taking a baggage of emotions back to their place. And in fact, we have a huge community worldwide which we all are a part of. It's called Not One More Vet, because I'm not sure if people out there know or not, but the highest rate of suicides is in our profession worldwide.
Why is it so?
That is because I know through personal experience so many of the times when there are certain people who come in, there is of course a fee for everything. If you go to a human doctor, there is a fee. If you go to buy medicines, there is a fee. But when we speak about the same fees, of course it is 10 times lower. But even then, people will come and they will say, oh, why are you charging for treatment? You probably don't love your pet, you don't love animals, or how can you charge us, or can't you do this for free of cost? Don't you love animals? This is the most primary accusation every single vet must have heard at some point or the other in their life. Apart from that, uh, they are really abused a lot. When certain things happen, they do everything in their power, and then if the animal is at a place from where which it cannot recover, even then the doctors are blamed. And apart from that, there is a lot of hate community happening from animal lovers at times. Because animal lovers keep thinking that vets are a different community and animal lovers are a different community, which is not the case. Most vets who have taken up or given their life to this wonderful profession were animal lovers at some point and decided to go further in and put their entire professional life in this. So many of the times when the people cannot afford treatment, it is me who is putting my pocket resources and treating the animal or operating the animal, saying that it's okay, but it's for the animal's sake. So a lot of this emotional baggage is taken back by the veterinarian after the day's work. So yeah, I mean there is a lot of professional burden which a veterinarian does carry at the end of the day. And we would want animal lovers to understand that we are no different from them. And we definitely want to try and do as much as we can, but even we have a capacity. This profession is the bread and butter of our life, and we cannot do everything free of cost, or we cannot do everything at a very subsidized rate. Things that require a certain charge to run the hospital, to get more equipments and uplift the whole level of care. We definitely need to what do you say, there is a certain amount of cost involved behind everything.
technology wise, we are still not up there, right? Like compared to other countries, more advanced countries, we are not so advanced when it comes to veterinary services. So when do you think like we'll be reaching the stage where we'll have world-class equipment, world-class treatment, world-class this thing for animals? Like we now humans, we have reached that stage where we have world-class,
Yes.
technology to treat them. But animals are
I wouldn't
still not
say we
done.
are very far behind or something. It's just it takes to start with. It takes respect for the profession by people. Abroad, people respect veterinarians way more than they respect a human doctor, because a human doctor learns about a male, female, old, and young. A veterinarian learns or has to deal with male, female, old, and young of a bird, of a dog, of a cat, of a cow, of a camel, of a snake, of fishes, of what, of elephants and sparrows and everything. You are expected to know everything under the sun, and that is superhuman. I feel about. I mean, being able to deal with everything, and every vet is so versatile. And to start with, we are still spoken to as जानवरों का doctor. Oh, okay. The respect is still not there. So
I
to
know.
start for our profession to get uplifted is for the people to start understanding the amount of years and efforts that we put in, and the respect that has to be given. It was so sad that we still have to fight for respect with at par with human doctors, whereas we are definitely doing way more than them. We are definitely making sure that we are able to help animals, even though they cannot tell us what is exactly wrong with them, and yet we have to eventually figure out. And most of the animals that come in are at the later stage. You For example, a human has a slight cold or a cough or a sneeze, they will immediately consult a doctor. For an animal, if they are hurting somewhere, they'll not be able to speak unless and until it becomes so unbearable that they are unable to stand up, they stop eating food, or they are limping, or they are probably vomiting. So all the animals that come, most of them are in advanced stage of some or the other medical ailment or surgical emergency. And from there, we have to get them back, not from the first initial sign that, oh, there was some lacrimation from the eye, or there was a single nasal discharge, or there was slight bout of fever and I need to get it tested. It doesn't happen with animals so often. And world class facility, already metropolitan cities like Mumbai, Pune, Bangalore, they already have wonderful facilities for animals, and there are vets who are only doing nothing but improving and getting in more equipments and instruments for them. So we already are at par. And there's a very funny thing that I would like to put in your notice is, when vets abroad, when we say London, that is Royal Veterinary College in London, which is one of the best veterinary colleges, etc., the students over there, while they are learning, they come for externship to places like India, because they have wonderful theoretical knowledge but zero practical knowledge. They don't get enough hands on. They are not allowed to touch the animals there. Whereas when they come to India, that is when they first understand how to give an injection. The Indian vets are teaching them how to give intravenous fluids, how to operate on dogs, and this is happening everywhere. And at the end of the day, these are the same countries that tell us that, oh, you need to have a different licensing exam to qualify to come to our country and practice. So it's a little funny and ironical, I feel, that these students come and learn everything hands on and understand so many things in our country, and then go back and tell us that, oh, we are not good enough. So I think it's a myth that Indian vets are not good enough. Indian vets are the ones who are out there. They're at the top of the field. Even abroad, every single place, you will see there are Indian vets everywhere on the top in the other countries as well. So we have definitely reached that place where we are giving world class facility to animals. The only thing is we need to also have people who understand the facilities that are provided and can, what do you say, appreciate it and are able to shell that kind of amount for their own pets as well.
True. But the only thing is that when you're working with the strays, like, so keeping a track of stray, like when he falls sick and and catching them or medicine, giving them medicines, that's a little where I think the treatment gets delayed, because when you observe them, you're feeding them, that yes, he's not feeling well. But then I know, from my own experience, like some of my cats and dogs, like they are difficult to catch and give them medicine. It's really tough, so even when you put the medicine in the food, they will spit it out. So at the most, what you can do is you can take drops, homeopathy drops or these kind of things, and put them in the water or milk and try and give them, and that takes time. So until they are really bad, then it's, as you said, it's by the time it's too late. Sometimes it's too late to even get them back. So that is
I
what
think
helps people who work with strays has a problem.
Correct. So we need to have a integrated service for animals, maybe a good NGO in every city where people can approach. Like in Nagpur, we have a lot of NGOs, but we were unable to still reach out to people. So now what we have done is I have managed to I'll show you. This is the operation theater that we have. This is my own rescue dog, Ruby.
Okay.
Ruby is basically, she was surrendered because of gastro 8 years ago, and we managed to. We didn't think she'd survive, but she miraculously survived and decided to stay with us. And so she is the hospital superintendent over here. So she makes sure that everybody is working well and all. This is our OPD.
Wow.
And we have a patient right there.
Okay.
Hi.
So this is your initiative, Vet Beyond Basics, huh, Babu?
Yes. Along with that, we have an X-ray unit. Okay. And like I was saying, this initiative includes free treatment for stray animals. Okay. A broken spine, and this one right. Okay. This one is a land cloud. This baby probably had an accident and doesn't have a part of the leg, but it's doing well now. Mm-hmm. So basically, you have a hospital kind of a thing where you admit them and you keep them until they are absolutely recover. You release them, is it? Okay. Yes, that's how it works. Over here, we have another vet colleague of mine. One second. This is your Vet Beyond Basics. Hi. Yes. This is Dr. Ashwarya. She's looking after this. Hasn't been named yet. So we have an X-ray unit set up. We have the complete diagnostic lab. We have got dogs all over. These are all abandoned stray dogs. Uh-huh. So they live here only, like, hi. Yes, they live here till they get adopted. Uh-huh. So you have adoption, this thing also, facility. Yes, we try and get them. They are vaccinated, they are dewormed, and we try and get them adopted. We have got some extra space to treat all the gastro patients, and apart from that, we have a shelter which is right adjoining to our hospital over here, and all the accident cases, the bigger dogs, we keep them over here, so they are treated twice a day. Right now, we thankfully don't have many dogs because they were released after treatment and back to the place where they have come from. Now, we don't charge a rupee for any of these treatments. All of these are done free of cost, and all the patients that come in that are not street dogs, which are owner patients, these are the ones which are charged, and that money is diverted towards the charitable cause. We have 2 such vans, street dog. Yeah. So we have a tie-up with this foundation, where we have two of these vans that run around the city for helping stray animals.
Okay. You really got a nice setup here. Okay.
Thank you.
You're also on
So
the
we are,
advisory board of SaveNishab.com, right?
yes, yes. So that is another initiative where over here, this is one thing that my parents had dreamed of for street animals, and I was able to realize that at this point, thankfully I was able to do it at a place where I am physically present. But there are so many cities, so many places where such facilities are not there, or people are not able to get a proper streamlined facility like this. So uh, I am also part of Save Nishab, where we try and raise donations for initiatives in other places. These are all for street animals or rescue animals. And apart from that, we also in future plan to have such setups throughout the state, and then eventually around the country.
That's really that would be amazing. Okay, you've already discussed that birds when during Sankranti when you have this bird problem. Apart from that, is there any situation or any case which was the most difficult and most challenging? How did you handle that?
Apart, well, Sankranti, every single day, every single hour is challenging, and you never know what is going to come through the doors, which bird is going to come through the doors, some rare bird, some endangered species. But apart from that, the most challenging I feel was, I'm not sure if you heard that there was a very large outbreak of something called as avian botulism in the Sambar Lake near Jaipur. This
Mhm.
was in 2019 November. And it was such a major outbreak that we lost more than 18 to 20,000 migratory birds because of botulism. And
What is that basically? What kind of disease is that?
so it's basically a bacteria. It is from a similar family to where the tetanus is born, basically, the same family of bacteria. And it is usually found at rusty places. So there were more than 700 illegal salt mines that were actually discovered during the botulism outbreak, and that the pipes that were put in for mining of salt, because it is one of Asia's largest saltwater lake, and those pipes had caught rust over a period of years, and that is where it harbored this botulism bacteria. And there was a series of things that happened, basically series of unfortunate events, that there was heavy rainfall, because of which a lot of crustaceans and fishes had been able to flourish at in that lake. After which there was a massive increase in the temperature during November, at least 3 degrees increase than the previous year, because of which there was a lot more evaporation than of the water, which attracted. Now, this is one place where migratory birds flock in every year, and this is November onwards is the time when you see them flocking in India, and they stay till around February to March, mid-March, around mid-March. And when these birds started coming in, they started eating these crustaceans, which were already harboring botulism that was in the water, that was in the contaminated water. Now, when they started eating it, the botulism is an anaerobic form of bacteria, which multiplies when there is lack of oxygen, lack of environmental air, which is the intestines of the birds. And it started multiplying, and the birds started dying of botulism. And then there were maggots that caught onto the birds, and new batch of birds came and ate those maggots that were already harboring botulism, which were feeding on the carcass of the dead birds. So it was a vicious circle that started, and the thing came to light on 11th of November, 10th of November, I think. And more than 5 to 6,000 carcass of birds were found by a bird watcher, and then it was reported to the Jaipur Forest Department. Eventually, the next day, more 5,000 were found, and then various teams, main being the Wildlife Trust of India, for whom I work as a wildlife avian veterinarian, and the teams reached on the spot. They did all the assessment, and there were drones that were actually flown out because the people who were salt mining illegally, they had cut out all the power lines and put the live wires in the water, so people cannot access the water. So the illegal mines are not caught. And apart from that, there were huge 60 to 80 feet bore wells that were dug deep in the lake. So even if the people who would go inside to collect the carcasses out, so more maggots would not flourish on them, they had the what do you say? They had the risk of drowning in such deep holes. So it was such a challenging rescue operation, which lasted for almost 3 months, and the amount of efforts that were taken by various groups of people was crazy. And apart from that, we had to set up in a nursery which was closer to the lake. We set up a rescue center where there were at least 4 to 5 vets working at a single point of time. And we were getting in all these birds that were paralyzed and they could not even flap their wings. We are holding them in the hand and they are not even trying to struggle out of it. They are all either paralyzed, showing nervous signs, and we had to feed them, keep them warm. They were all hypothermic. We had to give them intravenous fluids, subcutaneous fluids, and give them a warmth. And the only luxury that we had at that point was a small room which had a little bit of electricity, so we can provide some warmth to the birds. But apart from that, we had nothing. We were we were literally dying out in the cold because the second batch of birds in the evening would come only by 9:30, 10 in the night, and we would keep treating them till 11:30, 12, and then go back, and then next day morning 7 onwards we would be back to work. So it was one of the most challenging rescues that the entire team, the local team and the WTI team had carried out. So that was one experience I'll never forget. We managed to eventually save about 1,653 birds, and these were all migratory birds that were released back into the wild. They were given rings for identification, whether they are migrating back to our country the next year, that we will see. And that's how the whole rescue operation had taken place. So at least we were able to release a few of them. Majority of them had already succumbed in the water, because once they stop flapping their wings, once they get paralyzed, they would
They
either
drown.
starve to death or drown. Yeah,
It's really a pity. Like most of the it's humans who are behind everything. If you every disaster,
agreed.
like I don't know. I mean, like it's really it takes a toll on you emotionally, physically, and like a lot of it's a very stressful job. So how do you cope with that?
Even after doing the best possible things that you can or you could possibly do, sometimes nothing works, and sometimes even that goes in vain. So the only consolation that we take home is maybe we probably did not let the animal suffer for longer, or we at least did not let it suffer in pain. I mean, that is the only consolation we can take home at the end of the day. So apart from that, yes, it is very difficult to had I been going home to a house without pets, I think I would have been crazy by now. So yes, they my animals keep me sane, because at the end of the day they are my therapy animals. So yeah,
Yeah, stress busters.
stress busters,
They
truly.
are the true stress busters. Anything you would like to share with the future veterinary surgeons who would like to follow your footsteps and be either a wildlife or avian surgeon? Take up on that,
um I would like to say a lot of things to them, but I would
please.
just say don't get disheartened about anything. There are, of course, there are pros and cons to every profession, but this choosing a life to be a veterinary doctor, a veterinary surgeon is one of the most exciting things you can ever experience in your lifetime. You have no idea how your day is going to start, how it's going to end, what are you going to see, what experiences will call you. And definitely wildlife requires dedicated vets, no doubt about it. So of course, the current pay scale for wildlife veterinarians is not justifiable, but eventually, we hope that people do see the amount of work a wildlife vet puts in, and they are reimbursed in probably a justifiable way. But don't worry about that. The experiences are priceless. You cannot put a price tag on the experiences that you get, and you will be able to share with other people. And the best joy is when the animal is released back or the bird is released back. So uh, you will never get that joy uh, if you are working maybe in an office or something like that. I think people should be encouraged to go out there, if not just as a veterinarian, but as veterinary nurses or animal lovers who come and volunteer, and everything. I mean, you cannot live your life completely unless and until you've lived for these animals and birds at some point of your life. I mean, you can write about them, read about. I mean, you can do what not, spread awareness about them, but definitely at some way or the other, be a part of the change for them. I mean, be their voice. They don't have their own.
I agree with you, Ushma. It's like amazingly you put it together. Like, yes, it's an amazing experience when you have an animal and like you spend time with them and you do small things when, and the love and the joy that they give you. They don't pretend. If they are angry with you, they will show their anger. If they are upset with you, they'll show that. If they're, I mean, once they're happy to see you, the kind of joy that it's like amazing.
And no complaints.
And no
In
complaint.
case my dog is at home and I get late to come back from work, no complaints. She'll still be as happy to see me as I would come back after 10 minutes or after an hour or after
Yeah.
10 hours. She'd be the same amount of happy.
Thank you, Ushma, for your time. And it was
Definitely, Monica.
amazing experience talking to you. And all the best for your
I have
future.
the same experience. I am so happy that because of you, I have a platform to reach out to people, reach out, and I would not want people to see this as my work or what I have done. I would want them to see what veterinarians out there are doing, and this is just a small example or maybe a small thing that I'm doing. And there are hundreds of different veterinarians who are doing so much more.
Hmm.
So this is just a small part, a small way I am making a difference. But you can do a lot more. You can do 1,000 times better. Maybe, even if one person gets inspired, I'm more than happy.
Yeah, it's high time their vets are acknowledged for their services.
I agree.
Thank you, Ushma, and all the best for your thing.
Thank you so much, ma'am. It was really nice
Don't have, I
talking
mean,
to you.
Anu. Please call me Anu.
Anu, yes. Yeah.
So, and anytime I come to, I mean, if you happen to be in Bombay, please do connect. Like, I would like to meet you and personally.
Definitely.
And if I
Whenever
ever
I
happen to come
do.
to Nagpur, I would obviously love to
Oh
visit
my,
your.
anybody would have, if anybody of you listening, and you especially, Anu, if you do happen to come to Nagpur, let me host you, and let's do some rescue operations together whenever you
Sure.
are here.
Yes, would be my pleasure. I would love to do that. And I'm sure my readers and my viewers would also love to. Please, guys, go
100%.
ahead, meet her, see her facility, and help her in whatever way. And not just help her, help animals and birds and be a little
Help
more
them.
considerate towards them.
We are just a medium to help them, and
Yeah.
we would more the merrier. People who are aware about it, especially children. I was very surprised. There are so many children around the locality that we have our facility in, and they
Hmm.
keep
Hmm.
coming with injured animals, and they're like,
Hmm.
Didi, Didi, there's an animal here, auntie, there's an animal there which requires help, and we go and help them. They get so happy.
I know.
So that is the kind of positivity we need to inculcate in the next generation. So yeah, that's a
So
good
have you
side.
started anything for the create this kind of awareness among the students or the children?
For COVID, I used to take Ruby with me regularly. I've been to schools in Nagpur, in Gujarat, in Bombay, and I take my dog along. I give them awareness sessions on various things,
Hmm.
and for various age groups. Like really young kids also. I mean, 3, 4 year olds also have I've spoken to them and I've just shown them simple things like, just be gentle to animals. Don't throw stones.
Hmm.
Such are the small things that, make a big difference for people, for students who are above 8th standard, 9th standard. I've taken seminars for them uh, before COVID. That was much more interactive, of course.
Hmm.
And where they were told about the various cruelties that are happening
Hmm.
outside for the
Hmm.
animals, and they can, that is the time when they are still moldable, where
Hmm.
they can still be caught and told that, see, this is wrong, the cruelties
Hmm.
that are happening with animals, and you should think about it and probably change your actions, and not just your, but
Hmm.
go tell your parents, tell your family members, spread awareness. So
Hmm.
I have done a lot of such work with children, but now unfortunately with COVID, we have not been able to do any of those seminars again. But maybe once this pandemic goes down, then we'll probably start with
All
such
over again.
things. Really, a lot of work with snake bites and awareness on how to identify snake, what to do as a first aid, whom to call, and what are the not to panic, and what are the different protocols that you need to understand. Those things are told to children and adults both,
Yeah,
and
because
even
looking at the
around
snake
the
only,
ages.
yeah, people just the moment they see a snake, they just freeze and they say, okay, it has to be killed because it's
Yeah,
venomous. But they don't realize that
exactly.
it's not like most of them are not venomous,
And
and they
even if
don't
it
say
is a
it.
venomous snake, you don't need to
Huh.
kill
And
the
even if
snake.
they're
I
venomous,
mean,
they are not supposed to be killed because they also act in their own self-defense. Like if you let them be, they will
correct,
also walk
correct.
away. They don't want to interact with humans. No, I think no animal or bird or wild doesn't, they don't want to interact with animals. They just want to live
Yeah,
in
we
their
are
own
not that
world.
great. They
Yeah, we
don't
are
like
not
us.
that good. I agree with you. We are not so great. We are only making their life miserable and we are just
Yeah,
taking over the world, which is a pity, because we can't
I
survive
agree.
without them. And this pandemic
Agree.
is an example, and I think
True.
if we don't wake up now, I don't think so anything else can wake us up.
I agree. I
We've
agree.
already lost the world. I don't think so we should let it slip
Yeah,
by further if we don't hold on to it now and mend our ways. So that
agree.
message, I think we need nothing. And thank you, Ushma, again. And it was pleasure
Thank you so
talking to
much,
you.
Anu.
And I hope to
Same
catch
here.
up with you soon.
100%. Same here. I'm looking forward to it.